Kia ora, Brenda and Nicky. Thank you so much for joining us today. We're really keen to hear about your experiences here at the Faculty of Medical and Health Sciences, and also with starting your Doctor of Health Science program this year. So I thought we'd start with a little bit just finding out about you. So Nicky, would you like to tell us a little bit about your background?
Sure. So I've been working in hospitals since the mid-90s. I did a degree of child and youth studies in Canada. I moved to New Zealand just shortly after 2002, and I did some postgraduate study at Canterbury University after the earthquakes, focused on clinical teaching, and then shifted up to Auckland and Waikato. And so it's been about a decade since I've done any study. So I was a little bit anxious coming into this, but actually really, really enjoying it.
Oh, fantastic that you've come back to it. And Brenda, what's your background?
I'm a registered nurse. I have also had a gap, like Nicky was talking about. I did my master's actually back in psychology more than 10 years ago, and then got into nursing a little bit later, and then all the postgrad, and this is how I've worked through to the doctorate now where I am.
And you're both still working in the clinical space at the moment, as well as studying. Yeah. So Nicky, what made you decide to head on this journey and start the Doctor of Health Science?
Yeah, I think I work as a hospital play specialist. It's a very small profession, and there's not a lot of research coming out of New Zealand about the value of play in hospitals or the benefits of being able to minimise anxiety for kids, get them brought into their treatment, and involving them in things so that we really look at how do we prepare them for what's going on, coping strategies for things. So there's just not a lot of research showing the benefits of that, and I think we see it every day in our practice, but there's not a lot of stuff written down as evidence that we can go to for business cases and things. So just very conscious of raising that really for our profession.
Excellent. And Brenda, what about you? What made you decide to come and do the Doctor of Health Science?
Well, I'm a nurse. I'm a charge nurse actually of a respiratory ward, and as you know, we've just gone through the COVID phase, which is really great to have that behind us mostly. So that sort of had a big impact on it really, but in terms of just the opportunity to broaden and to have the opportunity to put into practice the learning and just take the next step really. I love research and I'm really looking forward to it.
What's the most valuable things so far that you've got out of your studies, do you think?
I think one of the things enrolling in this has enabled me to stop for a minute and have the space to think about some of the big picture stuff. I think it's really easy to get caught in the day-to-day business of work, and this has sort of really allowed me to carve out some time for that thinking and that big picture planning and things like that. So I found that very helpful.
Good. Brenda?
And I think I'd say really it's given the links. We've done 2 papers. We've had a research paper and a strategic management paper, and it's they've been really great because it's given the opportunity to link those 2 things, and of course it does link into with your practice clinically, and it all goes together, really fits well.
Good. I was going to ask about that, about what have you been able to take things back to your work environment?
Yes, definitely. As a charge nurse of a very busy ward and quite a big team, it's been very helpful actually. It has given me some strategies too that I can learn from and I have been able to put into place to make, to develop my own leadership and my role with my team down there.
Obviously this is taking you, the 4 taught papers are taking you towards your thesis and your actual research. Brenda, what are you planning on doing in your research?
My research is around nursing engagement and leadership in an area of something called antimicrobial stewardship, and that's just really simply about antimicrobial resistance and my other research area is sepsis, and they kind of go together quite well.
What are you hoping will come out of your research?
What I'm hoping to work towards is the goal. We don't have any antimicrobial stewardship nurse specialists in New Zealand. It's internationally for probably over 10 years. They are in place in many countries. We don't in New Zealand yet, so that's one goal. Another goal is also nursing education and competencies and KPIs. I'm interested to see that move into our nursing education system. And of course, most importantly, of course, is patient safety and making a difference and working to see where we can get.
Brilliant.
And Nicky, what are you planning on doing in your research?
So it's still evolving a little bit, which is exciting. But I think the focus for me really is on sort of raising the awareness of clinical staff around how we engage kids in their own care. So part of that's about giving kids a voice, meeting their rights of children in hospital. But there's a big equity piece in that as well, in terms of how we're approaching kids, what actually is the outcome of that. So I think a lot of it we know is that involving kids in their own care can really help minimize levels of anxiety, increase coping strategies, increase compliance, which is often helpful for our clinical colleagues, and really looking at how can we make that so that it's not just if you happen to have a play specialist in that one setting, and actually broadening people's understanding of the impact that can have for kids and their families. Yeah.
And how could we use that information in the future then to shape healthcare?
Yeah, well, I think some of it is as simple as, if I think about kids having vaccinations in community settings, if you're in a hospital setting and you're having a needle or an IV line put in, we have lots of ways of making that easier, breaking it down so that kids understand what's happening, facilitating their sort of ways of managing that and making it okay. And I think, there's lots of kids having smaller procedures in the community setting don't have that kind of support. So I think trying to broaden just the general understanding of the benefits of that, and whether that's that we've got resources that we develop, whether we use technology to help sort of spread that, across the country, make it more accessible for people.
Fantastic.
Yeah.
Now, if I had to ask you for 3 words to describe your experience studying so far, what would they be, Brenda?
Mentorship is probably the first that comes to mind. Flexibility as well, which we've been talking about, and collaboration. They're what comes to mind for me.
Nice. Mine would probably be supported. I feel like I've been very well supported in the program by both Brenda and the people who've been running our courses. I think in a really niche profession, it's really nice that this can be so individualized. So whilst we're talking about research methods and methodologies and approaches, it's all been within the context of my own work, which has been really fantastic. And I think inspiring. Yeah, I've met some people. I mean, research to me was a bit of a, I have to do this, but I was a little bit nervous about it. But actually, I've had, the more people I've spoken to and the more options there and lots of different perspectives. Yeah, I've found it really inspiring.
Yeah. And I guess finally, is there any advice that you would give to people who are considering undertaking the program?
I think it's something you should really consider. It's a great opportunity, and as a senior nurse, it's an opportunity for your professional development. It's an opportunity to make a difference. It's an opportunity if you have something you're really passionate about in health, and it gives you the support, brings everything together, and you can give birth to a new idea to support something which is really exciting and Yeah.
I think for me probably it's definitely housed in the School of Nursing, but there's been really, really broadly accepted that you can come from any health background, which I really love. So I would say if you're considering this and you're working in allied health, there's ways to make it really applicable to your own role. So I think just being really clear about what it is you're interested in, why you want to study, and then it's really, really well supported. I'm going to say pleasantly surprised. It sounds like the wrong thing to say, but I've actually been really pleasantly surprised about how easy and facilitated it has all been. Yeah.
Good.
Yeah.
Oh, well, I hope everything goes swimmingly and that your studies progress well.
Cheers.
We look forward to seeing the results.
Thanks.